Yeah, I mean, I'm a great fan of how the health system is run in Thailand, where the health system is considered sacrosanct. Nobody touches it. It's got a formula, and you run that formula. Everybody, no matter what political party, supports that formula. End of story. And the formula is you run it as a primary healthcare centered healthcare system, but at the same time you ensure that there's good access to high level care. Right now, I believe that we are at the cusp of being able to deliver on this type of care, where because we've during the COVID time we've developed command centers. The command centers have improved communication. We've also developed outreach capability, so people can go out, big teams can go out and do outreach. And then at the same time, we've also improved our retrieval capability. That means if people are ill, we can bring them in. We also trained community health workers so that community health workers can have more presence on the ground. We've also become wise on community engagement strategies that allow us to get the community to be involved in our health programs. And I think that it won't, together with the type of program or training that we're doing right now, I believe that we are at the cusp of being able to change some behavior so that we are not only preventing disease, but we also, those people who have disease, we are preventing them from getting complications. Like that, everybody becomes productive for as long as they can. And I'm hoping that in time to come, it will become recognized that the health system needs to be left alone. It should not be touched. Nobody should talk about it. Nobody should undermine it. Let it develop the way it's supposed to develop. And that means it needs to develop together with a lot of private-public partnerships. We need to have a lot of other private sector entities involved in providing our care. I think that when it comes to things like high-end care, cardiac surgery, that's exactly what's happening in Lotoka. We're trying to get a lot of private entities to enter into that, into a way of providing that service and making that service exist in Fiji shores for a sustainable period of time. When it comes to primary health care, things like provision of fuel, maintenance of our facilities, that needs to be also something that we run with private sector, because that's more sustainable for us. If we do all that, that means the healthcare workers will just concentrate on providing health, and the rest of the corporate functions will be provided outside of the healthcare service. But it does require that people be a bit more patient and ensure that we just try to walk through the various plans for private sector engagement. Private sector engagement doesn't come easy. It means that you have to have a different way of operating. It means that we have to be able to provide oversight over the private sector engagement, making sure that the private sector engagement actually delivers what it's supposed to deliver, and making sure that what we pay for, we get.